What is ADHD? ADHD is a neurodevelopmental disorder that affects both children and adults. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning or development. ADHD is typically diagnosed in childhood, but many people are not diagnosed until they are adults. Symptoms of ADHD. ADHD symptoms can vary from person to person and generally fall into two main categories: inattention and hyperactivity, impulsivity. Inattention symptoms. 1. Difficulty staying focused. People with ADHD may find it hard to focus on tasks, whether in school, work, or personal activities. 2. Easily distracted. They may be easily distracted by irrelevant stimuli or their own thoughts, making it hard to stay on task. 3. Forgetfulness. Forgetting to complete tasks, lose things like keys or assignments, and miss deadlines is common. 4. Difficulty following through. Starting tasks but not finishing them, or shifting focus between tasks without completing them. Hyperactivity and impulsivity symptoms. 1. Fidgeting or restlessness. A constant need to move, such as tapping fingers or squirming in seats. 2. Difficulty staying seated. In adults, this might translate into restlessness at work or in meetings. 3. Excessive talking. Speaking out of turn or talking excessively, even when it's not appropriate. 4. Impulsivity. Making decisions or taking actions without thinking about the consequences, e.g., interrupting others or acting on impulse. Causes of ADHD. The exact cause of ADHD is not fully understood, but several factors are believed to contribute to its development. 1. Genetics. ADHD tends to run in families, suggesting a genetic link. 2. Brain structure and function. Differences in brain structure, particularly in areas that control attention, impulses, and activity, have been observed in people with ADHD. 3. Environmental factors. Exposure to toxins like lead, alcohol consumption during pregnancy, or premature birth can increase the risk. Diagnosis of ADHD. Diagnosing ADHD typically involves 1. Clinical evaluation. A thorough medical evaluation including interviews with the person, family members, and teachers, for children. 2. Rating scales. Questionnaires or standardized forms to assess behavior patterns in various environments. 3. Rule out other conditions. Since ADHD symptoms can overlap with other conditions like anxiety, depression, or learning disabilities, a full assessment is essential. Treatment of ADHD. ADHD can be managed with a combination of treatments. The approach varies depending on the severity of symptoms and individual needs. Medication. 1. Stimulants. Medications like methylphenidate, Ritalin, and amphetamines, Adderall, are commonly prescribed and help increase dopamine and norepinephrine in the brain, improving focus and reducing hyperactivity. 2. Non-stimulants. Medications like atomoxetine, Strattera, or guanfacine are alternatives for those who don't respond well to stimulants. Behavioral therapy. 1. Cognitive behavioral therapy, CBT, is often used to help individuals develop coping strategies and organizational skills. 2. Parent training and behavior management programs can also help children with ADHD improve their behavior and skills. Lifestyle adjustments. 1. Exercise. Regular physical activity can improve focus and reduce hyperactive behavior. 2. Nutrition. A balanced diet, avoiding excess sugar or caffeine, and ensuring adequate sleep can help manage ADHD symptoms. 3. Structured environment. Creating a predictable, organized environment with clear routines and goals can help reduce distractions. Mental health and ADHD. ADHD often co-occurs with other mental health conditions, including 1. Anxiety and depression. People with ADHD are at a higher risk for anxiety and mood disorders. 1. It's important to address both ADHD and any coexisting conditions to ensure comprehensive treatment. 2. Low self-esteem. Due to difficulties with organization, focus, and social interaction, people with ADHD may struggle with feelings of inadequacy or frustration. Coping strategies and wellness tips for ADHD. 1. Time management techniques. Using tools like timers, alarms, or apps to manage tasks and deadlines can help individuals with ADHD stay on track. 2. Mindfulness practices. Techniques like mindfulness meditation can improve focus and reduce impulsivity. 3. Setting small goals. Breaking tasks into manageable chunks and setting achievable goals can make large tasks feel less overwhelming. 4. Support networks. Support from friends, family, or ADHD coaching can provide emotional support and practical strategies for dealing with challenges.